Hello, my name is Gus Weirs, and this is No Chat Cleft Behind. This is a podcast bringing awareness of cleft palates and lips and what we can do to help. Lips and palates are birth defects that occur when a baby's lip or mouth does not form properly. They happen during early pregnancy. A baby can have a cleft lip, a cleft palate, or both. A lip forms between the 4th and 7th week of pregnancy. Cleft lip happens if the tissue that makes up the lip does not join completely before birth. This results in an opening in the upper lip. The opening in the lip can be a small slit, or it can be a large opening that goes through the lip into the nose. A cleft lip can be on one or both sides of the lip, or in the middle of the lip, which occurs very rarely. Children with a cleft lip also can have a cleft palate. The roof of the mouth is formed between the 6th and 9th week of pregnancy. A cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. For some babies, both the front and the back parts of the palate are open. For other babies, only part of the palate is opened. The genes that caused clefting may be passed from either parent. A parent with a cleft has at least a 5% chance of passing along the trait. However, if the clefting is associated with a recognized genetic syndrome in which the genes are dominant rather than recessive, the chance of inheritance becomes 50%. Clefting may also result from environmental disruptions in the development. These disruptions may be triggered by drugs, tobacco, or the ribella virus. The mother's diet during pregnancy may also affect the likelihood of clefting. This critical fusion stage takes place very early in the pregnancy, before many women even find out they are pregnant, so they may not yet have stopped using substances that may be harmful to the fetus or begun taking parental vitamins. The CDC estimates that each year in the United States about 2,650 babies are born with a cleft palate, and 4,440 babies are born with a cleft lip, with or without a cleft palate. Isolated or facial clefts, or clefts that occur with no major birth defects, are one of the most common types of birth defects in the United States. Depending on the cleft type, the rate of isolated or facial clefts can vary from 50% to 80%. Estimated that lip or without cleft palate affects 1 in 940 births in the United States, presenting in approximately 4,437 cases each year. Cleft lip and or palate that occurs with no other major defects is the most common birth defect in the United States. Cleft lip and cleft palate occur very early in pregnancy. Many possible causes are being investigated, but no single cause has been identified. The majority of clefts appear to be due to a combination of genetic and environmental factors. Other cases appear to be isolated incidents, which meaning there are no family history or indication or any other health problems. The risk of recurrence of a cleft condition is dependent on many factors, including the number of affected persons in the family, the closeness of affected relatives, the race and sex of all affected persons, and the severity of the clefts. The Center for Disease Control and Prevention and research groups have identified several risk factors that increase the chance of having a baby with a cleft. These include genetic factors as well as smoking during pregnancy, diabetes, substance abuse, certain medicines, especially for epilepsy, and poor parental health. Smoking. Women who smoke during pregnancy are more likely to have a baby with an orofacial cleft than women who don't smoke. Diabetes. Women diagnosed before pregnancy have an increased risk of having a child with a cleft palate or a cleft lip compared to women who do not have diabetes. Use of certain medications. Women who use certain medications to treat epilepsy, such as tampormate or valproic acid, during the first trimester of pregnancy have an increased chance of having a baby with or without cleft palate compared to women who do not use these medications.